All right, great. So we're going to move along with our agenda for this morning. The next segment is going to be a presentation on behalf of the LA Bus Babies Network team titled Standing with Home Visitors, How LABBN Supported the Family Strengthening Network in Fiscal Year 21 and 22. So in a moment, you're going to hear from each of the LABBN teams and how we contributed to the work that you do, the Family Strengthening Network, but also assisted in the larger county system-wide action planning and building the home visiting network within the county as well. But before Martha screen shares that, or even if she does, I've got another joke. All right. What does a baby computer call his father? What does a baby computer call his father? Wow, no reaction, nothing. Brittany, that's better than any Mac Daddy. That's like better than what I was, mine was going to be data, like data, but Mac Daddy is so way better. Brittany, if you have other jokes, send them my way. I like them. All right. Laptop, nope, close, but nope. But Mac Daddy is so way better than what I was going to say. All right. Because I failed at that joke, I am going to take us into our presentation. I'm going to be presenting on behalf of Dr. Yanakura and I. You've all likely seen Dr. Yanakura in one space or another, but Dr. Yanakura is the executive director here of LA Best Babies Network. She's also the manager of community benefits at California Hospital. So you've got us there visually, and I'm just going to quickly go over what we've done this last fiscal year. Of course, we oversee the LABBN network staff, vetting new opportunities for networking, collaboration, and funding. You heard Dr. Allen talk a little bit about the data lake idea. So we're going to be a big part of that. And we're looking forward to bringing multiple home visiting programs together in an opportunity to share each other's data, but also build out reports and ultimately be able to show the larger impact of this work in the county. As always, we are initiating program planning and goals for what we do as a network, responsible for creating new relationships, collaborating, strategic thought partnerships, even someone like Shola, bringing someone into the network, diversifying our consultant pool, diversifying our training pool, making sure there's continuing education, all of that. Those are all creating relationships and making our network even bigger than before. We're always monitoring progress, measuring outcomes. We want to make sure that not only are we meeting the goals that you're all set to meet, but also our own with our own strategic plan. We're serving as liaisons and content experts between grantees, funders, third-party evaluators for all the things that are going on, continuing to support the county with home visiting initiatives and opportunities for expansion. You heard Dr. Allen and John this morning talk about the Family First Prevention Service Act dollars. So there's a lot of work that the LABBN management and leadership team is doing and taking part in FFPSA work groups as a way to help integrate those dollars that are coming in through DCFS into the home visiting network. And of course, as always, sharing network best practices, data, and strategies with national partners, both in publications, in presentations, and so on. And with that, I am going to now pass it on to my colleague, Larissa, who is the manager of grants and operations and who oversees our administrative team. Larissa, it's all you.
Sure. Thank you, Charlene. Good morning, everyone. My name is Larissa Malik, and I'm the Manager of Operations and Grants at LA Best Babies Network. I oversee two positions at LABBN, which is Office Coordinator and Administrative Coordinator position. Both positions are currently vacant, and we're in the process of hiring two brand new individuals to actually join our LABBN team. At our administrative support team, we collaborate with all the teams within LABBN and FSOE Network. We handle logistics for collaborative projects and LABBN's organizational operations. We manage, purchase, and monitor program materials and distribution of those materials to the sites. And we serve as the liaison leader between California Hospital Medical Center and LABBN. Some of the highlights and accomplishments for this fiscal year include adding one new employee to our team back in 2021, who was our manager of training and technical assistant, Renee. 207 orders were actually placed for Welcome Baby program materials. Over 700 gift boxes were ordered and distributed to the Family Strengthening Network for the summit. And we significantly reduced our carbon footprint by going paperless with electronic binders. The next slide shows the overview of all the program materials that we purchased for fiscal year 21-22. We ordered 9,408 healthcare kits, 9,024 Boppy pillows, 1,464 plug protectors, 1,800 cabinet latches, 3,500 3-month toys, and 3,234 9-month toys. Over 10,000 welcome baby books in Spanish and English version was also ordered. Overall, we actually purchased 38,430 items this fiscal year. Our administrative support team actually collaborates with technical assistant team and also communication team. Some of the highlights for the work that we have done throughout this fiscal year was providing maintenance and support for the Chromebook technological bundles. We assisted with the data collection for the COVID-19 site assessment surveys. Over 70 meeting minutes actually were made and distributed to the throughout the fiscal year 21-22. 52 weekly event newsletters were actually sent out to the Family Strengthening Network. And finally, we conducted quarterly program material surveys and monitored material distribution during COVID-19. Now I'm going to pass it to Jana for her side of presentations. Thank you.
Thank you, Larissa. Good morning, everyone. My name is Jana Wright, and I, along with Laurel and Anna, make up LABBN's policy team and the backbone support team for the Los Angeles County Perinatal and Early Childhood Home Visitation Consortium, which is so long, so we just refer to it as the consortium. So our presentation today is going to be broken down into two parts, consortium and policy, and we're going to start with the consortium. So the purpose of the consortium is to bring together all the parts of home visiting, from the staff, advocates, and funders to work towards expanding home visiting services in LA County. The consortium has 6 work groups, and I'll be sharing some highlights of each of the work groups. So the advocacy work group's biggest accomplishments of the past year have been collecting stories from the field and creating new one-pagers for policymakers and health audiences. Since officially joining the consortium in October of 2020, the African American Home Visiting Engagement Work Group has really taken off. The group completed the best practices hiring guide for increasing African American home visiting staff and has engaged consultants to hold focus groups with Black home visiting staff. The Best Practices Work Group created the Home Visiting Outreach Best Practices Guide and hosting learning sessions on how to integrate parent voice into the consortium. The Data Work Group collected data and completed the fiscal year 2021 descriptive and outcomes indicators reports, as well as a staff diversity report to give us a baseline of how we're doing in terms of staff diversity of home visiting staff. The Referrals Work Group administered and analyzed the biannual barrier surveys, and from these results, the work group has hosted 3 webinars. The work group has also developed a general home visiting one-pager that's appropriate to use for all audiences. And the newest work group of the consortium, the Father Engagement Work Group, has worked tirelessly to compile research into what is now known as the Father Involvement Report. If you want access to any of these reports, be sure to check out our website, homevisitingla.org, and I'll put it in the chat as well. Other highlights from this year include the completion of the consortium's racial equity audit, approval of the strategic plan, and the consortium's first ever racial equity grounding session. We continued our newsletter to streamline communications, the weekly rundown, which is sent to over 320 individuals at the end of every week. And the consortium is growing. We accepted 2 new member organizations over the past year. Now for LABBN's policy review, which will be much shorter. Policy is important to our families, though, because it shapes their worlds. Everything from how much paid family leave they can take to which formula brands our WIC families can purchase is impacted by policy. So over this past fiscal year, we tracked over 31 bills and we submitted 19 letters of support. In addition, we led efforts to create LA County's first ever home visiting day, which was held on April 8th of this year, a huge accomplishment for the consortium and for our home visiting efforts in LA County. And next, we'll hear from Steve and Amy from the communications team. Thank you.
Thanks, Jana, and good morning, everyone. I'm Amy Miramontes Franco, the communications specialist at LA Best Babies Network, and I work closely alongside Steve Nish, who is our manager of communications and outreach, who will also be presenting with me today, and Valerie, who has served as our communications intern over the last couple of months. So here are some highlights of some of the work that we've been doing over the past year to support and promote the great work that you all do. And to start off, we're sharing about our most recent achievement, which is the development of the Spanish Welcome Baby book. So we've been hard at work translating the latest edition of the English Welcome Baby book into Spanish. And today we're really happy to share that the online version is available for use. And it's also being printed and prepared for distribution as we speak. We've also launched an online resource library full of Spanish language handouts, guides, and other useful information that's intended to support the material available in the Spanish Welcome Baby book. This is also available online and available for all home visiting staff to use and share with the clients that they serve.
All right, thanks, Amy. Hi, everybody. I'm Steve, and next here on the slide, we have new outreach material. Of course, every time we reprint materials, we update them with information. We're trying to make sure that everybody knows that virtual visits are still available in all of our materials. We have new banners out, big 8x5 vinyl banners. And as you saw, I think at the beginning of the presentation in Martha's Mentimeter, stand-up banners. Those two that were pictured were with our wonderful HLs at California Hospital. But new materials keep coming, and we're hoping to keep getting more referrals to the welcomebabysupport.org website with those.
That's right. And on June 8th, as Jana mentioned, we celebrated Home Visiting Day here in LA County. And our team worked closely with Jana, Laurel, and the rest of the consortium to develop the website for this day. We also played a role in the development of the Home Visiting Day social media toolkit.
Yes, and that, as Jana mentioned, that Home Visiting Day, April 8th this year, we hope to make that an annual thing. So stay in tune with homevisitingday.org. Yes, we got that domain, and it's going to get bigger every year. New partnerships. We've, as mentioned at the beginning of the program, we with Family First, with Promise Health. We have new partnerships to try to get more referrals to Welcome Baby and home visiting programs through DCFS, probation, and through healthcare plans.
And we've continued to update the Stronger Families blog with a variety of resources, including the weekly list of upcoming events on a variety of perinatal health and family strengthening topics.
And lastly, but not leastly, outreach monthly meetings. We meet every month with our terrific team of outreach specialists in the Welcome Baby program. So I just want to give a shout out to them for all the terrific ideas, bringing up challenges, and then bringing up solutions in these meetings that we have every month. And now I will pass it over to my friend Renee to talk about training and TA.
Hi, Steve. Thank you. It's nice to see everyone, at least virtually. So like you shared, my name is Renee Aguilar. I'm the manager of training and technical assistance. Our team consists of Terry Ossiano, the public health research associate and training coordinator for First 5 LA, Patrick Flippin Weston, public health research associate and training coordinator for the county funded sites, Martha Bach, public health research associate for the TA team, Kayla Kakavan, and our newest member, Vanessa Reyes, who round out the rest of our team as public health research associates. Together, we support program staff in delivering quality services across all 3 home visiting models, promoting best practices and improving programmatic outcomes through targeted technical assistance. Our team is in charge of training all new staff, providing ongoing advanced training opportunities, and utilizing periodic assessments and evaluations to assess and address programmatic needs and maintain model fidelity. Our year's efforts focused on capacity building, training, offering unique learning opportunities to expand staff knowledge and skill, and supporting overall workforce development. We welcomed 88 new staff to the network. We trained 425 total staff. We offered 14 specialized trainings throughout the year. We facilitated 132 meetings to enhance technical assistance with network members. We distributed 329 surveys, which I think you realize where they go to. And our TA team had the opportunity to present at the Interagency Council on Child Abuse and Neglect Conference, which highlighted the work you guys all do as home visitors to prevent child abuse and neglect. I will end with the short video with words from 2 of our cohort speakers, Gabrielle Kaufman from Maternal Mental Health Now and Diane Reynolds from Reflective Practice Consulting.
Hi, I'm Gabrielle Kaufman with Maternal Mental Health Now, and I've had the honor of training so many of you. And I was invited today to just come and tell you how much I appreciate all the work that you do. It's been a hard couple of years, and you show up every single day and make such a difference in the lives of the families that we serve. Thank you for your work. My heart to you.
Hello, beautiful people. Hello, home visitation staff across LA County. I wish I could climb through this camera and hug each and every one of you and share my appreciation for all that you do. Instead, I hope you will take a moment to take a deep breath in and make a long, slow, regulating exhale. And just acknowledging all that you do for so many. I hope you will take a moment to receive the ocean and love of ocean of love and appreciation that I am sending your way right now, right where you are. Thank you for all that you do and for so many whose lives you have touched. So appreciative.
I'll keep us going by introducing Osvaldo Lopez, the database trainer and support specialist for the data team. Osvaldo.
Thank you, Renee. I hope my audio is good. Hello, everyone. Happy Summit. My name is Osvaldo Lopez. I am the database trainer and support specialist here at LABBN. And I'm very excited to present to all of you my team's infographic. As you may know, the data team is made up of 6 members. We all have different tasks and responsibilities, but we work together to assist and support the network. And so with that, I would like to start off by highlighting our accomplishments. And the first accomplishment here is in regards to, we created data analysis to promote continuous quality improvement, ongoing countywide database operations, and that is to include database developments, trainings, and technical support. We also created data visualization reports for multiple stakeholders, such as home visiting models, funders, and agencies. Another one of our accomplishments includes the standardization of data collection and reporting across the home visiting network. We provided consent and authorization form guidance for risk management purposes. And lastly, we also provided trainings and consultations on use, monitoring, and interpretation of data. So with that, let's go on and introduce the data team. That's my team. And first off, we have Delisa Young, Manager of Data and Evaluations. She can be contacted for continuous quality improvement inquiries, HIPAA guidance, consent and authorization forms, and for any reporting needs, basically. Next, we have Monica Charles, Senior Data Analyst. And Monica can be contacted for Tableau report requests, questions, and Tableau trainings. We have Brandon Crom, Data Analyst. He can be contacted for Tableau report requests and questions. Next up, we have Vanessa Delgadillo, Database QA and Project Specialist, and she can be contacted for questions regarding data collection forms, database changes and updates, and for database trainings. This is Jonathan Jimenez, Database Trainer and Support Specialist 2. And Jonathan can be contacted for database access, database support questions, questions about consent and authorizations, and database user guides. And last but not least, yours truly, I can be contacted for database user access, database support questions, and for database user guides. And to conclude my presentation, I would like to also spotlight our contributions to the network. And one of our contributions is we facilitated continuous quality improvement efforts related to referral pathways, client engagement and retention, and overall best practices. Provided data collection efforts for partners, including county consortium, managed care plans, and external evaluators. Continued success in adapting to all the changes stemming from the transition to the virtual world, such as database and report modifications. We participated in Tableau Conference Customer Panel to show how the network leverages Tableau for CQI and decision-making. There was an increase in Tableau report production to assist in data-informed decision within the network. And lastly, we provided resources to assist with funding and agency transition of clients to different funding sources or agencies. And so with that, I will now turn it over to Vanessa Reyes for the next raffle that we have. Thank you.
Awesome. Thank you, Osvaldo. Lots of love in the chat. Yes. Go Tater team. You rock. Oh, LABPN staff. Thank you, Jill. Okay. Let me dive right in. Share my screen once more. All right. So let's get started on our next raffle. All righty. My handy dandy number generator, and the winner is Janice Rodriguez from El Nido. Congratulations, Janice. And stop screen sharing. Alrighty. So next up, before we get into the data, we're going to get into a video, and I'm going to introduce reintroduce Amy, who will be doing our data presentation. Data video.